Question 1. The control framework reveals that a parent expresses concern regarding a noticeable difference in their child's leg length, stating the child appears to favor one leg when walking. The child is 4 years old and has no reported history of trauma or significant illness. As an OPA, what is the most appropriate initial course of action to address this concern? Option A. Reassure the parent that limb length discrepancies in young children are common and usually resolve on their own, advising them to monitor the situation. Option B. Advise the parent to research limb length discrepancies online and return if the difference becomes more pronounced. Option C. Immediately refer the child to a pediatric orthopedic surgeon for surgical evaluation and potential correction of the limb length discrepancy. Option D. Conduct a thorough physical examination, including assessment of gait, limb alignment, and range of motion, followed by a detailed history and consideration of age-appropriate imaging if indicated. Correct answer is D. Conduct a thorough physical examination, including assessment of gait, limb alignment, and range of motion, followed by a detailed history and consideration of age-appropriate imaging if indicated. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric orthopedics where a parent's concern about their child's limb length discrepancy, while potentially benign, requires a thorough and evidence-based assessment to rule out significant underlying pathology. The challenge lies in balancing parental reassurance with the professional obligation to investigate potential developmental abnormalities of the musculoskeletal system, adhering strictly to OPAC scope of practice and established pediatric orthopedic guidelines. Misinterpreting or dismissing parental concerns without proper evaluation could lead to delayed diagnosis and treatment of serious conditions, while over-investigation could lead to unnecessary anxiety and cost. Correct approach analysis. The correct approach involves a systematic, age-appropriate physical examination focusing on gait, limb alignment, range of motion, and palpation for bony abnormalities. This is followed by obtaining a detailed history, including birth history, developmental milestones, and any family history of skeletal issues. Based on these findings, appropriate imaging such as plain radiographs will be ordered to assess bone length, alignment, and epiphyseal development. This approach aligns with the OPAC's role in assisting orthopedic surgeons by performing initial assessments, gathering data, and formulating a differential diagnosis under supervision. It adheres to the principle of first, do no harm by ensuring a comprehensive evaluation before proceeding with more invasive or definitive interventions. Regulatory frameworks for OPAC emphasize the importance of accurate patient assessment and the appropriate use of diagnostic tools within their scope of practice. Incorrect approaches analysis. One incorrect approach would be to dismiss the parental concern solely based on the child's age, assuming that all limb length discrepancies in young children are physiological and will resolve spontaneously. This fails to acknowledge the potential for congenital or acquired conditions that require early intervention. Ethically, this approach neglects the professional duty to investigate patient complaints thoroughly. Regulatory failure would occur if this dismissive attitude leads to a misdiagnosis of a condition like congenital hip dysplasia or a significant growth plate injury, which could have long-term functional consequences. Another incorrect approach would be to immediately recommend surgical intervention without a comprehensive diagnostic workup. This bypasses essential steps in assessing the severity of the discrepancy, the underlying cause, and the child's growth potential. This is a regulatory failure as it exceeds the OPAC's scope of practice, which typically involves diagnostic assistance rather than independent treatment planning for complex conditions. Ethically, it is premature and potentially harmful, exposing the child to unnecessary surgical risks. A third incorrect approach would be to rely solely on parental anecdotal information or online resources without performing a clinical examination or ordering appropriate diagnostic imaging. This demonstrates a lack of professional diligence and adherence to evidence-based practice. Regulatory failure stems from not utilizing established diagnostic protocols and potentially misinforming the patient and family based on unreliable data. Professional reasoning. Professionals should employ a structured decision-making process that begins with active listening to the patient or guardian's concerns. This is followed by a comprehensive history and physical examination, guided by the OPAC's scope of practice and relevant pediatric orthopedic literature. The next step involves formulating a differential diagnosis and determining the most appropriate diagnostic tests, prioritizing non-invasive methods first. This systematic approach ensures that all potential causes are considered, leading to an accurate diagnosis and a tailored treatment plan, always in collaboration with the supervising orthopedic surgeon. Question 2. Examination of the data shows an orthopedic physician's assistant certified OPA reviewing an MRI of a patient's knee. The MRI report highlights a small area of increased signal intensity on T2-weighted images within the medial meniscus, but the clinical history is vague regarding specific symptoms. The OPAC must determine the next steps in patient management. Which of the following represents the most appropriate course of action for the OPAC? Option A. Immediately communicate to the patient that the MRI shows a meniscal tear and recommend surgical intervention. Option B. Rely solely on the automated MRI report's description of increased signal intensity and proceed with ordering a follow-up MRI in 6 months. Option C. Independently interpret the MRI, correlate it with the vague clinical history, and formulate a preliminary diagnosis to discuss with the supervising orthopedic surgeon. Option D. Focus only on the T2-weighted sequence findings and dismiss the vague clinical history as irrelevant to the interpretation. The correct answer is C. Independently interpret the MRI, correlate it with the vague clinical history, and formulate a preliminary diagnosis to discuss with the supervising orthopedic surgeon. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic practice where a physician's assistant, PA, must interpret complex imaging findings to guide patient care. The challenge lies in ensuring the interpretation is accurate, clinically relevant, and adheres to established protocols and the scope of practice for an OPAC, particularly when subtle findings might be present or when the initial interpretation requires further clarification. The PA must balance the need for timely diagnosis with the imperative of diagnostic accuracy and patient safety, all within the regulatory framework governing their practice. Correct approach analysis. The correct approach involves a systematic review of the MRI sequences, correlating findings with the patient's clinical presentation, and consulting with the supervising orthopedic surgeon. This aligns with the OPAC's role as an extender of the physician, requiring them to possess a strong understanding of diagnostic imaging principles and their application in orthopedic conditions. Regulatory guidelines for PAs emphasize collaboration and consultation with supervising physicians, especially when complex diagnostic decisions are involved. This approach ensures that the interpretation is not only technically sound, but also clinically appropriate and safe for the patient, reflecting best professional practice and adherence to the scope of practice. Incorrect approaches analysis. One incorrect approach is to solely rely on the automated report generated by the MRI machine without independent review or clinical correlation. This fails to acknowledge the limitations of automated reporting and the critical role of clinical context in interpreting imaging. Ethically and regulatorily, this could be considered a failure to exercise due diligence and professional judgment, potentially leading to misdiagnosis and inappropriate treatment. Another incorrect approach is to make a definitive diagnosis based on a single MRI sequence, without considering all available sequences or the patient's history. MRI interpretation is multifaceted, requiring the integration of information from various sequences, e.g., T1-weighted, T2-weighted, fat-suppressed images, to fully characterize tissue abnormalities. This approach risks overlooking crucial details or misinterpreting findings, violating the principle of comprehensive diagnostic evaluation and potentially leading to patient harm. A third incorrect approach is to communicate a preliminary or uncertain finding directly to the patient without first consulting with the supervising orthopedic surgeon. While patient communication is important, the OPAC's role is to assist the physician. Making definitive statements about potentially complex or uncertain findings before physician review can lead to patient anxiety and misunderstanding, and it bypasses the established chain of command and collaborative care model mandated by regulatory frameworks. Professional reasoning. Professionals should approach such situations by first understanding the patient's clinical presentation and the specific questions the MRI is intended to answer. Next, they should systematically review all available MRI sequences, looking for abnormalities and their characteristics. This review should be followed by a thorough correlation with the patient's history, physical examination findings, and any previous imaging. Crucially, if any findings are equivocal, complex, or outside the PA's established comfort level or scope of practice, consultation with the supervising orthopedic surgeon is paramount. This iterative process of review, correlation, and consultation ensures diagnostic accuracy, patient safety, and adherence to professional and regulatory standards. Question 3. Performance analysis shows that an orthopedic physician's assistant certified OPA is evaluating a 10-year-old patient presenting with a noticeable curvature of the spine. The patient's parents express significant anxiety about their child's future health and appearance. The OPAC has reviewed the initial X-rays, which confirm idiopathic scoliosis with a Cobb angle of 35 degrees. Which of the following represents the most appropriate next step for the OPAC in managing this patient's care? Option A. Conduct a thorough discussion with the patient and parents about the diagnosis, treatment options including observation, bracing, and surgical intervention, and collaboratively develop a management plan, ensuring referral to an orthopedic surgeon for definitive care. Option B. Immediately schedule the patient for surgical spinal fusion, as this is the standard of care for a Cobb angle of 35 degrees in a growing child. Option C. Provide the parents with a pamphlet on scoliosis and advise them to monitor the child's posture at home, deferring further intervention until the curve progresses significantly. Option D. Prescribe a course of physical therapy focused on strengthening back muscles, as this is often sufficient to correct moderate scoliosis without the need for further specialized evaluation. The correct answer is B. Immediately schedule the patient for surgical spinal fusion, as this is the standard of care for a Cobb angle of 35 degrees in a growing child. Explanation. Scenario analysis. This scenario presents a common challenge for an orthopedic physician's assistant certified OPA involving a pediatric patient with a congenital disorder, specifically idiopathic scoliosis. Professional challenge lies in balancing the immediate need for accurate diagnosis and treatment planning with the long-term implications for a growing child and the family's understanding and adherence to the treatment plan. Ethical considerations are paramount, including informed consent, patient autonomy, within the context of a minor, and the OPAC's duty to provide competent care. The OPAC must navigate the complexities of a potentially progressive condition, the emotional impact on the family, and the need for multidisciplinary collaboration. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered strategy that aligns with the OPAC's scope of practice and ethical obligations. This involves a thorough history, physical examination, and appropriate diagnostic imaging to confirm the diagnosis and assess the severity of the scoliosis. Crucially, it includes detailed discussion with the patient and their guardians about the diagnosis, treatment options, including observation, bracing, or surgery, potential risks and benefits, and the expected course of the condition. This approach prioritizes shared decision-making, ensuring the family is empowered to participate actively in the treatment plan. It also necessitates appropriate referral to an orthopedic surgeon for definitive management and ongoing care, reflecting the collaborative nature of healthcare and the OPAC's role in facilitating access to specialized expertise. This aligns with professional standards of care, emphasizing evidence-based practice and patient advocacy. Incorrect approaches analysis. One incorrect approach would be to solely rely on imaging without a thorough clinical assessment and discussion with the family. This fails to acknowledge the psychosocial aspects of managing a chronic condition in a child and neglects the importance of informed consent and shared decision-making, potentially leading to patient dissatisfaction and non-adherence. Another incorrect approach would be to recommend a specific treatment without consulting with the supervising orthopedic surgeon or a specialist in pediatric orthopedics. This violates the OPAC's scope of practice and could result in inappropriate or delayed care, posing a risk to the patient's well-being. A third incorrect approach would be to dismiss the family's concerns or provide overly simplistic explanations, which undermines trust and fails to address the emotional impact of the diagnosis. This is ethically unsound and detrimental to the therapeutic relationship. Professional reasoning. When faced with a pediatric patient diagnosed with a congenital disorder like idiopathic scoliosis, an OPAC should employ a systematic decision-making process. This begins with a comprehensive clinical evaluation, followed by appropriate diagnostic workup. The next critical step is to engage in open and honest communication with the patient and their guardians, explaining the diagnosis, prognosis, and all available treatment options in a clear and understandable manner. This communication should be a dialogue, allowing for questions and addressing concerns. Based on the clinical findings and the family's preferences and values, the OPA, in collaboration with the supervising physician and potentially other specialists, will formulate a treatment plan. This plan should be regularly reviewed and adjusted as needed, with ongoing patient and family education and support. The OPAC's role is to facilitate access to the highest level of care, advocate for the patient, and ensure continuity of care. Question 4. System analysis indicates a patient presence to the orthopedic clinic with a history of a forceful twisting injury to the right knee during a soccer game. The patient reports immediate, sharp pain localized to the medial joint line and significant swelling. The PA suspects a meniscal tear, but also considers a possible ligamentous injury. Which of the following diagnostic approaches best reflects a comprehensive understanding of the musculoskeletal anatomy and physiology of the knee to guide initial management? Option A. Focus solely on palpating the medial joint line for tenderness and administering a local anesthetic injection. Option B. Prescribe a course of anti-inflammatory medication and recommend rest, without further diagnostic workup. Option C. Immediately refer the patient for a surgical consultation to address the suspected meniscal tear. Option D. Perform a thorough physical examination including specific orthopedic tests for meniscal and ligamentous integrity, followed by X-rays to rule out fracture, and if indicated, an MRI to evaluate soft tissue structures. The correct answer is D. Perform a thorough physical examination including specific orthopedic tests for meniscal and ligamentous integrity, followed by X-rays to rule out fracture, and if indicated, an MRI to evaluate soft tissue structures. Explanation. Scenario analysis. A physician's assistant PA encounters a patient presenting with acute, severe knee pain following a fall. The PA must quickly and accurately assess the underlying musculoskeletal injury to initiate appropriate management. This scenario is professionally challenging because a misdiagnosis could lead to delayed or incorrect treatment, potentially causing long-term joint damage, chronic pain, or functional impairment for the patient. The PA's responsibility extends beyond immediate symptom relief to understanding the intricate anatomy and physiology of the knee joint to determine the precise nature of the injury. Correct approach analysis. The correct approach involves a systematic evaluation that integrates the patient's history of the fall, a thorough physical examination focusing on the knee's biomechanics and structural integrity, and the judicious use of diagnostic imaging. This aligns with the OPAC scope of practice, which emphasizes comprehensive patient assessment and management of orthopedic conditions. By considering the mechanism of injury, fall, the location and character of pain, and performing specific orthopedic tests, e.g., Lachman test for ACL, McMurray test for meniscal tears, the PA can formulate a differential diagnosis. Subsequent imaging, such as X-rays to rule out fractures and MRI to visualize soft tissues, provides definitive diagnostic information. This multimodal approach ensures accurate diagnosis, which is fundamental to providing evidence-based, patient-centered care within the established regulatory framework for PAs in orthopedics. Incorrect approach is analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain and prescribe pain medication without a comprehensive physical examination or diagnostic imaging. This fails to address the underlying pathology, potentially masking a serious injury like a fracture or ligamentous tear, and violates the ethical and regulatory obligation to provide thorough diagnostic workups. Another incorrect approach would be to immediately order an invasive surgical consultation based on initial suspicion, without a detailed assessment and non-operative management considerations. This bypasses the PA's role in initial assessment and management, potentially leading to unnecessary surgical interventions and increased patient risk and cost, without adhering to the tiered approach to orthopedic care. A third incorrect approach would be to focus only on the immediate pain and apply a generic treatment plan without considering the specific anatomical structures involved in the knee joint and their physiological function. This demonstrates a lack of understanding of musculoskeletal anatomy and physiology, which is a core competency for an OPAC and could lead to ineffective or even harmful treatment. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes patient safety and accurate diagnosis. This involves 1. Gathering a detailed history, including the mechanism of injury. 2. Performing a focused physical examination, assessing range of motion, stability, and palpating for tenderness. 3. Developing a differential diagnosis based on findings. 4. Selecting appropriate diagnostic studies, imaging, labs to confirm or refute diagnoses. 5. Formulating a treatment plan based on the confirmed diagnosis and patient factors. 6. Collaborating with supervising physicians when necessary. This systematic process ensures that all relevant anatomical and physiological aspects are considered, leading to optimal patient outcomes. Question 5. Analysis of a 65-year-old male patient presenting with persistent, dull pain in his left femur, exacerbated by weight bearing. He reports a history of falls but denies any acute trauma. Radiographic imaging reveals subtle osteopenia and a slight bowing of the femur. The OPAC is tasked with evaluating the underlying cause of the pain and developing an initial management strategy. Considering the patient's age, symptoms, and imaging findings, which of the following best reflects an understanding of bone structure and function in this context? Option A. The pain is likely due to a stress fracture, and the management should focus on rest and gradual return to activity, considering the role of cortical bone in resisting tensile and compressive forces. Option B. The symptoms are indicative of degenerative joint disease in the hip or knee, and the focus should be on managing articular cartilage wear and tear. Option C. The pain is primarily a manifestation of soft tissue inflammation, and treatment should involve NSAID and physical therapy to address muscle strain around the femur. Option D. The osteopenia and bowing suggest a potential underlying metabolic bone disease affecting trabecular bone integrity, which is crucial for shock absorption and bone strength, necessitating further investigation into systemic causes. Correct answer is A. The pain is likely due to a stress fracture, and the management should focus on rest and gradual return to activity, considering the role of cortical bone in resisting tensile and compressive forces. Explanation: this scenario presents a professional challenge due to the need to accurately assess and interpret complex bone structure and function in the context of patients presenting symptoms. The OPAC must demonstrate a deep understanding of biomechanics, cellular processes, and the interplay between different bone tissues to formulate an appropriate diagnostic and treatment plan. Misinterpreting these fundamental principles can lead to delayed diagnosis, inappropriate interventions, and potential patient harm, which carries significant professional and ethical implications. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based evaluation of the patient's bone health. This involves correlating the patient's subjective complaints with objective findings, considering the specific roles of cortical and trabecular bone in load-bearing and metabolic functions, and understanding how pathological processes can disrupt these functions. Adherence to established diagnostic protocols and consultation with supervising physicians, as mandated by OPAC scope of practice guidelines, ensures patient safety and optimal care. An incorrect approach that focuses solely on superficial symptoms without a thorough understanding of underlying bone mechanics would be professionally unacceptable. This failure to delve into the structural and functional integrity of the bone would violate the ethical obligation to provide competent care and could lead to misdiagnosis. Another incorrect approach might involve recommending a treatment based on a limited understanding of bone remodeling or repair processes, potentially exacerbating the condition or causing iatrogenic injury. This would represent a failure to apply knowledge of bone physiology and could contravene guidelines for evidence-based practice. A third incorrect approach might be to overlook the potential for systemic conditions affecting bone health, focusing only on the localized presentation, which would be a failure to consider the holistic patient and the complex etiologies of bone pathology. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly gathering patient history and performing a physical examination. Second, integrating this information with knowledge of bone anatomy, physiology, and biomechanics to generate differential diagnoses. Third, ordering appropriate diagnostic imaging and laboratory tests to confirm or refute these diagnoses. And fourth, collaborating with the supervising physician to develop and implement a treatment plan that addresses the root cause of the patient's bone-related issues, always prioritizing patient safety and evidence-based practice. Question 6. Stakeholder feedback indicates that some orthopedic physicians, assistants certified OPA, are experiencing challenges in consistently differentiating between various tendon and ligament pathologies, leading to variations in initial management strategies. Considering the regulatory framework for OPAC practice, which of the following approaches best optimizes the process for accurate diagnosis and appropriate initial management of suspected tendon and ligament injuries? Option A. Implement a standardized protocol for all suspected tendon and ligament injuries that includes a detailed patient history, a focused physical examination assessing range of motion, palpation for tenderness, and specific provocative tests for the affected structures, with clear guidelines for when to order imaging. Option B. Initiate immediate conservative management, such as rest and ice, for all reported musculoskeletal pain without a thorough diagnostic workup, assuming most cases are minor strains. Option C. Rely primarily on patient descriptions of pain and functional limitations to guide initial treatment decisions, deferring detailed physical examination until the patient reports a significant change in symptoms. Option D. Encourage patients to seek direct referrals to physical therapy for all tendon and ligament complaints, with the OPAC providing only a brief symptom summary to the therapist. The correct answer is A. Implement a standardized protocol for all suspected tendon and ligament injuries that includes a detailed patient history, a focused physical examination assessing range of motion, palpation for tenderness, and specific provocative tests for the affected structures, with clear guidelines for when to order imaging. Explanation. This scenario presents a professional challenge due to the inherent variability in patient presentation and the need to balance evidence-based practice with individualized care for tendon and ligament injuries. The OPAC must navigate potential diagnostic ambiguities and treatment complexities, ensuring patient safety and optimal outcomes within the established scope of practice. Careful judgment is required to differentiate between conditions, assess severity, and select appropriate interventions, all while adhering to regulatory guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic evaluation of the patient's condition. This includes a thorough history, detailed physical examination focusing on the affected tendons and ligaments, and judicious use of diagnostic imaging when indicated. This aligns with the OPAC's responsibility to provide competent and ethical care. As mandated by the regulatory framework governing physician assistants, it ensures that treatment decisions are informed by accurate diagnosis and tailored to the specific injury, minimizing the risk of misdiagnosis or inappropriate management. An incorrect approach that relies solely on patient self-reporting without objective assessment fails to meet the standard of care. This could lead to delayed or incorrect diagnosis, potentially exacerbating the injury or leading to ineffective treatment, which is a violation of the ethical duty to provide diligent care. Another incorrect approach that involves initiating aggressive, unproven treatments without a clear diagnosis or established evidence base disregards the principle of evidence-based medicine and could expose the patient to unnecessary risks and harm, contravening regulatory requirements for safe and effective practice. An approach that defers all complex cases to the supervising physician without attempting initial assessment and management, where within the OPAC scope, demonstrates a failure to utilize their training and expertise effectively and may not be the most efficient use of healthcare resources. Professionals should employ a decision-making process that begins with active listening to the patient's concern, followed by a systematic clinical assessment. This involves formulating differential diagnoses, selecting appropriate diagnostic tools, and developing a treatment plan that is evidence-based and individualized. Regular reassessment and communication with the supervising physician are crucial for complex or evolving cases, ensuring a collaborative and patient-centered approach. Question 7. The performance metrics show a statistically significant variation in the documented degrees of passive external rotation achieved by patients at their 6-week post-operative follow-up after arthroscopic rotator cuff repair. Which of the following actions by the orthopedic physician's assistant certified OPA best addresses this variability while adhering to professional standards and regulatory expectations for patient care documentation? Option A. Rely on the patient's subjective report of their perceived range of motion as this reflects their functional limitations and is a key component of their overall recovery experience. Option B. Encourage the clinical team to use their clinical judgment to estimate the range of motion based on visual observation, as this is often faster and sufficient for tracking general progress. Option C. Implement a mandatory in-service training session for all clinical staff on standardized goniometric measurement techniques for passive external rotation, including specific landmark identification and consistent patient positioning, and update the electronic health record (EHR) template to include fields for both the measured degree and the method of measurement. Option D. Instruct the clinical team to focus on palpating muscle strength and joint stability during the 6-week follow-up, as these are more critical indicators of surgical success than precise range of motion measurements. Correct answer is C. Implement a mandatory in-service training session for all clinical staff on standardized goniometric measurement techniques for passive external rotation, including specific landmark identification and consistent patient positioning, and update the electronic health record (EHR) template to include fields for both the measured degree and the method of measurement. Explanation: the performance metrics show a trend of inconsistent range of motion (ROM), assessments being documented for patients' post-arthroscopic rotator cuff repair. This scenario is professionally challenging because accurate and consistent ROM assessment is fundamental to monitoring patient progress, guiding rehabilitation, and ensuring optimal functional outcomes. Variations in assessment can lead to inappropriate treatment adjustments, delayed recovery, or even patient dissatisfaction and potential litigation. The OPAC's role demands adherence to established clinical protocols and regulatory guidelines for patient care documentation and assessment. The correct approach represents best professional practice because it emphasizes standardized, objective measurement techniques and clear documentation, aligning with the OPAC's responsibility to provide evidence-based care. This ensures that all patients receive consistent evaluation, allowing for reliable comparison of progress over time and across different practitioners. Adherence to established protocols, often informed by professional orthopedic guidelines and potentially state medical board regulations regarding scope of practice and documentation standards, is paramount. An incorrect approach that relies on subjective patient reporting without objective measurement fails to meet professional standards for clinical assessment. This can lead to inaccurate progress tracking and potentially inappropriate therapeutic interventions, violating the ethical obligation to provide competent care. Another incorrect approach that uses inconsistent goniometric angles or fails to document the specific method of measurement introduces variability and reduces the reliability of the data, potentially contravening documentation requirements set forth by regulatory bodies overseeing healthcare professionals. A third incorrect approach that prioritizes speed over accuracy in ROM assessment compromises patient safety and the integrity of the clinical record, which is a direct ethical and regulatory failure. Professional decision-making in such situations requires a systematic approach. First, identify the core clinical need, accurate ROM assessment. Second, consult relevant professional guidelines and regulatory requirements for best practices in assessment and documentation. Third, implement standardized protocols for all team members. And fourth, ensure ongoing training and quality assurance to maintain consistency and adherence to standards. Question 8. Research into the optimal diagnostic pathway for a 45-year-old male presenting with acute, non-traumatic knee pain and swelling, a palpable effusion, and limited range of motion, but no signs of instability or neurovascular compromise, prompts consideration of imaging. Which of the following diagnostic imaging approaches best reflects current best practices and regulatory considerations for this presentation? Option A. Immediate magnetic resonance imaging, MRI of the knee to comprehensively assess all soft tissue and bony structures. Option B. Initial plain film X-rays of the knee, anterior, posterior, lateral, and sunrise views to evaluate for bony pathology and joint alignment, followed by further imaging if clinically indicated. Option C. Ultrasound of the knee to evaluate the effusion and assess for meniscal tears and ligamentous integrity. Option D. Computed tomography, CT, scan of the knee to rule out subtle fractures and assess joint congruity. The correct answer is A. Immediate magnetic resonance imaging, MRI, of the knee to comprehensively assess all soft tissue and bony structures. Explanation: This scenario presents a common challenge in orthopedic practice, balancing the need for diagnostic information with patient safety and resource utilization. The OPAC must critically evaluate the necessity and appropriateness of advanced imaging modalities. The challenge lies in discerning when a less resource-intensive or less invasive imaging technique is sufficient, thereby avoiding unnecessary radiation exposure, cost, and potential patient discomfort or anxiety, while still ensuring accurate diagnosis and effective treatment planning. The correct approach emphasizes a stepwise, evidence-based diagnostic strategy. This aligns with the principles of prudent medical practice and regulatory guidelines that advocate for the judicious use of diagnostic resources. By starting with a thorough clinical assessment and progressing to imaging only when indicated by clinical findings, and then selecting the most appropriate modality based on the suspected pathology and patient factors, the OPAC demonstrates adherence to best practices. This approach minimizes patient risk, optimizes healthcare spending, and ensures that diagnostic efforts are directly relevant to the patient's condition, thereby supporting effective and timely orthopedic care. An incorrect approach that immediately orders advanced imaging without a clear clinical indication fails to adhere to the principle of medical necessity. This can lead to overutilization of healthcare resources, increased patient exposure to radiation, in the case of CT or fluoroscopy, and potential for incidental findings that may cause further anxiety and unnecessary investigations. Regulatory frameworks often require justification for advanced imaging, and ordering it without a strong clinical rationale can be considered a deviation from professional standards and potentially a violation of payer guidelines. Another incorrect approach that relies solely on a single imaging modality without considering alternatives overlooks the nuanced diagnostic needs of different orthopedic conditions. For example, ordering an MRI for a suspected simple fracture that would be clearly visualized on an X-ray is inefficient and exposes the patient to a longer scan time and potential claustrophobia without added diagnostic benefit for that specific indication. This demonstrates a lack of critical thinking in diagnostic imaging selection. Finally, an approach that disregards patient history and physical examination findings in favor of imaging alone is fundamentally flawed. The clinical assessment is paramount in guiding diagnostic imaging. Without this foundation, imaging can be misinterpreted or lead to a diagnostic fishing expedition. This approach neglects the core tenets of patient-centered care and evidence-based medicine, potentially leading to misdiagnosis or delayed appropriate treatment. The professional decision-making process for similar situations involves a systematic evaluation. 1. Thoroughly review the patient's history of present illness, past medical history, and perform a comprehensive physical examination. 2. Formulate a differential diagnosis based on the clinical findings. 3. Determine if imaging is necessary to confirm or refute the differential diagnosis. 4. If imaging is indicated, select the most appropriate modality based on the suspected pathology, patient factors, e.g., contraindications to MRI, pregnancy, cost-effectiveness, and availability of resources, adhering to established clinical guidelines. 5. Interpret the imaging findings in the context of the clinical presentation. 6. Develop a treatment plan based on the integrated clinical and imaging data. Question 9. The risk matrix shows a moderate likelihood of avascular necrosis in a patient undergoing surgical repair of a complex tibial plateau fracture. Considering the critical role of the periosteal blood supply in bone healing, which of the following approaches best mitigates this specific risk? Option A. Aggressively elevating the periosteum to gain wide exposure for optimal fracture fragment visualization and manipulation. Option B. Employing a minimally invasive surgical technique with meticulous dissection to preserve periosteal blood vessels. Option C. Proceeding with a standard open reduction and internal fixation without specific modifications to address vascular supply. Option D. Focusing solely on achieving rigid fracture fixation, assuming the bone will regenerate its vascular supply post-operatively. The correct answer is B. Employing a minimally invasive surgical technique with meticulous dissection to preserve periosteal blood vessels. Explanation. The risk matrix shows a moderate likelihood of avascular necrosis, AVN, in a patient undergoing a complex fracture repair involving significant periosteal stripping. This scenario is professionally challenging because the OPAC must balance the necessity of surgical intervention for fracture healing with the potential for iatrogenic complications affecting the bone's vascular supply. Careful judgment is required to select the most appropriate surgical technique and postoperative management to mitigate this risk, adhering to established orthopedic principles and patient safety guidelines. The correct approach represents best professional practice by prioritizing a surgical technique that minimizes disruption to the bone's vascular supply. This aligns with the OPAC's ethical and professional responsibility to provide patient care that is both effective and safe, minimizing harm. Specifically, employing minimally invasive techniques or carefully planned approaches that preserve vascular integrity directly addresses the identified risk of AVN. This proactive strategy, informed by an understanding of bone vascularity, is a cornerstone of sound orthopedic practice and is implicitly supported by the overarching principles of patient care and professional competence expected of an OPAC. An incorrect approach that involves aggressive periosteal elevation without meticulous attention to vascular preservation would be professionally unacceptable. This failure to consider the vascular supply to the bone, despite the risk matrix highlighting AVN, demonstrates a lack of due diligence and a disregard for established orthopedic principles. Such an approach could lead to compromised bone healing and increased morbidity, violating the ethical duty to avoid harm and the professional standard of care. Another incorrect approach might be to proceed with a standard technique without any specific modifications to address the vascular risk, assuming the risk is acceptable. This passive stance fails to acknowledge the elevated risk identified and does not demonstrate the proactive problem-solving expected of a competent OPAC. It represents a failure to apply knowledge of bone vascularity to a specific clinical challenge, potentially leading to an adverse outcome. Finally, an incorrect approach that focuses solely on fracture fixation without considering the long-term viability of the bone due to compromised vascularity would be a significant professional failing. This demonstrates a narrow focus that neglects the holistic care of the patient and the bone's biological response to injury and intervention. The professional decision-making process for similar situations should involve a thorough risk assessment, as indicated by the risk matrix. This assessment should then inform the selection of surgical techniques and postoperative care plans. The OPAC must actively integrate their knowledge of anatomy, physiology, and surgical principles, particularly concerning the vascular supply to bones and joints, into their clinical decision-making. Collaboration with the supervising physician and consultation of relevant literature or guidelines are also crucial steps in ensuring optimal patient outcomes and adherence to professional standards. Question 10. Cost-benefit analysis shows that implementing a standardized protocol for physical therapy modalities in postoperative orthopedic care could reduce overall treatment costs. However, an OPAC is evaluating a patient recovering from a complex rotator cuff repair who presents with significant pain and limited range of motion. Which of the following approaches best aligns with professional practice and patient-centered care? Option A. Utilize a broad spectrum of physical therapy modalities without specific patient-centered justification to ensure all potential benefits are explored, regardless of cost or individual need. Option B. Prioritize modalities that the supervising physician has a known preference for, assuming these are the most effective based on their experience. Option C. Implement the standardized protocol, focusing on the least expensive modalities that are generally considered beneficial for shoulder rehabilitation to maximize cost savings. Option D. Recommend a multimodal approach incorporating manual therapy, therapeutic exercise, and modalities such as ultrasound and electrical stimulation, tailored to the patient's specific pain levels, functional deficits, and rehabilitation goals, with ongoing reassessment of efficacy. The correct answer is D. Recommend a multimodal approach incorporating manual therapy, therapeutic exercise, and modalities such as ultrasound and electrical stimulation, tailored to the patient's specific pain levels, functional deficits, and rehabilitation goals, with ongoing reassessment of efficacy. Explanation. This scenario is professionally challenging because it requires the orthopedic physician's assistant certified OPA to balance patient-centered care with the efficient and cost-effective delivery of physical therapy modalities. The OPAC must consider the evidence-based efficacy of different modalities, the patient's specific condition and goals, and the potential for overutilization or underutilization of services. The regulatory framework for OPACS emphasizes patient safety, quality of care, and adherence to established practice standards, which implicitly includes the judicious use of therapeutic interventions. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment to determine the most appropriate physical therapy modalities. This aligns with the OPAC's responsibility to provide evidence-based care and to tailor treatment plans to the unique needs of each patient. By considering the patient's functional limitations, pain levels, and rehabilitation goals, the OPAC ensures that the chosen modalities are not only clinically indicated, but also contribute meaningfully to the patient's recovery and long-term well-being. This approach is ethically sound, as it respects patient autonomy and promotes optimal outcomes. An incorrect approach that focuses solely on the most readily available or least expensive modalities fails to consider the specific clinical needs of the patient, potentially leading to suboptimal outcomes or the need for further, more costly interventions down the line. This could be seen as a failure to adhere to the standard of care and could violate ethical principles of beneficence and non-maleficence. Another incorrect approach that relies on a broad, unselected application of multiple modalities without clear justification risks overtreatment and unnecessary expense, which is contrary to the principles of efficient healthcare delivery and could be viewed as a breach of professional responsibility to manage resources wisely. A third incorrect approach that prioritizes modalities based on provider preference rather than patient need or evidence-based guidelines disregards the core tenets of patient-centered care and evidence-based practice, potentially leading to ineffective treatment and patient dissatisfaction. Professionals should employ a decision-making framework that begins with a thorough patient assessment, followed by a review of current evidence-based guidelines for the specific orthopedic condition. This should then be integrated with the patient's individual goals and preferences to select the most appropriate and cost-effective physical therapy modalities. Regular reassessment of the patient's progress and the effectiveness of the chosen modalities is crucial for ongoing treatment adjustment. Question 11. Which approach would be most appropriate for an OPAC managing a 65-year-old patient with symptomatic end-stage osteoarthritis of the knee, who is a poor surgical candidate due to significant comorbidities including uncontrolled hypertension and obesity, and who is expressing frustration with current conservative management? Option A. Recommend immediate referral to a pain management specialist for aggressive opioid therapy to manage the patient's symptoms, without further exploration of other treatment modalities. Option B. Advise the patient that surgical intervention is not an option given their comorbidities and suggest they simply learn to live with the pain. Option C. Initiate a discussion about alternative, less invasive surgical options or investigational procedures, while also reinforcing the importance of optimizing medical management of comorbidities and exploring advanced non-surgical pain management strategies. Option D. Proceed with scheduling a total knee arthroplasty, assuming the patient's desire for surgery outweighs the identified risks. The correct answer is C. Initiate a discussion about alternative, less invasive surgical options or investigational procedures, while also reinforcing the importance of optimizing medical management of comorbidities and exploring advanced non-surgical pain management strategies. Explanation. This scenario presents a common challenge in orthopedic practice, managing a patient with symptomatic osteoarthritis who is seeking surgical intervention but has contraindications for standard procedures. The professional challenge lies in balancing the patient's desire for relief with the physician's assistant's responsibility to ensure patient safety and provide evidence-based care within the scope of practice and regulatory guidelines. Careful judgment is required to assess the risks and benefits of various treatment pathways, considering the patient's overall health status and the limitations of available surgical options. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and conservative management before escalating to more invasive or experimental interventions. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to regulatory expectations for responsible patient care, which often mandate exploring all appropriate conservative measures and ensuring that surgical interventions are indicated and feasible. This approach involves shared decision-making with the patient, ensuring they understand the rationale behind the proposed plan and their role in managing their condition. An incorrect approach that immediately suggests an unproven or off-label surgical technique without exhausting conservative options would represent a failure to adhere to established clinical pathways and potentially violate the principle of non-maleficence by exposing the patient to unnecessary risks. Such an approach could also be considered a regulatory failure if it deviates from accepted standards of care, or if the proposed intervention is not within the scope of practice for an orthopedic physician's assistant certified OPA without appropriate supervision or institutional approval. Another incorrect approach, such as dismissing the patient's symptoms due to the presence of contraindications without offering alternative management strategies, would be ethically problematic, violating the principle of justice, fair treatment, and potentially leading to patient abandonment. It also fails to uphold the professional responsibility to provide ongoing care and support. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's condition, including a thorough history, physical examination, and review of diagnostic imaging. This should be followed by an exploration of all appropriate conservative management options, such as physical therapy, pain management, lifestyle modifications, and assistive devices. If surgical intervention is still considered, a careful risk-benefit analysis must be performed, taking into account the patient's comorbidities and the availability of evidence-based surgical techniques. Consultation with the supervising orthopedic surgeon and potentially other specialists is crucial. Finally, open and honest communication with the patient about all available options, their risks, benefits, and expected outcomes is paramount to shared decision-making. Question 12. The review process indicates that a patient initially diagnosed with a simple distal radius fracture, treated with closed reduction and casting, is now presenting with persistent, severe pain and limited functional use of the affected limb, despite adherence to post-reduction instructions. Imaging from the initial presentation appears to show some subtle irregularities that were not definitively addressed. What is the most appropriate next step for the orthopedic physician's assistant certified OPA? Option A. Discharge the patient from care, advising them to seek further evaluation if symptoms significantly worsen, as the initial diagnosis and treatment were deemed appropriate at the time. Option B. Continue with the current casting and instruct the patient to continue with conservative management, assuming the pain is a normal part of the healing process. Option C. Immediately reevaluate the patient with a comprehensive physical examination, review all imaging studies in detail, and consult with the supervising orthopedic surgeon to discuss potential alternative diagnoses or complications. Option D. Focus solely on managing the patient's pain with analgesics and reassure them that discomfort is expected with this type of fracture. The correct answer is C. Immediately reevaluate the patient with a comprehensive physical examination, review all imaging studies in detail, and consult with the supervising orthopedic surgeon to discuss potential alternative diagnoses or complications. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in orthopedic care, managing a patient with a complex traumatic injury where initial assessment may have missed subtle but significant findings. The professional challenge lies in balancing the urgency of treatment with the need for thoroughness and accuracy, ensuring patient safety and optimal outcomes. The OPAC's role requires a high degree of clinical judgment, adherence to established protocols, and a commitment to continuous learning and patient advocacy. The potential for delayed diagnosis or inappropriate management due to incomplete information underscores the importance of meticulous review and decisive action. Correct approach analysis. The correct approach involves a comprehensive reevaluation of the patient's condition, including a detailed review of all imaging studies, a thorough physical examination focusing on the affected limb and surrounding structures, and consultation with the supervising orthopedic surgeon. This systematic process ensures that all diagnostic information is considered, potential complications are identified, and a revised, evidence-based treatment plan is formulated. This aligns with the OPAC's responsibility to provide high-quality patient care, acting within their scope of practice, and collaborating effectively with their supervising physician, as mandated by the regulatory framework governing physician assistants. It prioritizes patient safety by addressing any potential oversights and ensuring the most appropriate management strategy is implemented. Incorrect approach is analysis. Proceeding with the initial treatment plan without further investigation would be a significant regulatory and ethical failure. It demonstrates a lack of due diligence and could lead to patient harm if the initial assessment was indeed incomplete. This approach disregards the principle of patient safety and the OPAC's duty to ensure accurate diagnosis and treatment. Discharging the patient without a complete reevaluation, based solely on the initial findings, is also professionally unacceptable. This neglects the potential for missed injuries or developing complications, violating the standard of care expected of a healthcare professional. It could be construed as negligence and a breach of the OPAC's ethical obligations to their patients. Focusing solely on the patient's subjective complaints without objectively re-examining the injury and imaging would be an incomplete and potentially dangerous approach. While patient reports are crucial, they must be correlated with objective findings. This method fails to address the possibility of objective findings being overlooked or misinterpreted, thereby not fulfilling the OPAC's responsibility for a thorough assessment. Professional reasoning. In situations involving potential diagnostic discrepancies or evolving patient conditions, a structured problem-solving approach is essential. This involves 1. Recognizing the discrepancy or concern. 2. Gathering all relevant information, patient history, physical exam, imaging, previous records. 3. Analyzing the information critically to identify potential causes for the discrepancy. 4. Consulting with the supervising physician and potentially other specialists. 5. Developing and implementing a revised, evidence-based plan of care. 6. Documenting all findings, decisions, and actions meticulously. This systematic process ensures that patient care is optimized and that all professional and regulatory obligations are met. Question 13. The analysis reveals that a patient diagnosed with severe osteoporosis, who has failed multiple standard bisphosphonate therapies, is requesting a novel, expensive anabolic agent that is not currently on their insurance formulary and has limited peer-reviewed data supporting its long-term efficacy in their specific clinical profile. As an orthopedic physician's assistant certified, OPA, what is the most ethically and professionally sound course of action? Option A. Immediately inform the patient that the medication is not covered by their insurance and therefore cannot be prescribed, without further investigation into alternative options or consultation with the supervising physician. Option B. Prescribe the novel anabolic agent directly to the patient, assuming the patient's request implies a strong desire for this specific treatment, and address insurance and physician consultation issues later. Option C. Thoroughly review the patient's medical history. Consult with the supervising orthopedic surgeon regarding the latest evidence and potential off-label use considerations. Explore all available patient assistance programs or clinical trials for the requested medication, and engage in shared decision-making with the patient to discuss all findings, risks, benefits, and alternative treatment pathways. Option D. Advise the patient to seek a second opinion from a different specialist who might be more willing to prescribe the medication, without conducting an independent assessment of the patient's current situation or the medication's appropriateness. The correct answer is C. Thoroughly review the patient's medical history. Consult with the supervising orthopedic surgeon regarding the latest evidence and potential off-label use considerations. Explore all available patient assistance programs or clinical trials for the requested medication, and engage in shared decision-making with the patient to discuss all findings, risks, benefits, and alternative treatment pathways. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in healthcare, where a physician's assistant, PA, must balance patient autonomy, beneficence, and the practical realities of resource allocation within a healthcare system. The challenge lies in determining the most appropriate course of action when a patient's request for a treatment, while potentially beneficial, may not align with established clinical guidelines or insurance coverage, and the PA has a duty to advocate for the patient while also adhering to professional and regulatory standards. Correct approach analysis. The correct approach involves a thorough, evidence-based assessment of the patient's condition and the proposed treatment, followed by open and honest communication with the patient and the supervising physician. This aligns with the OPAC's ethical obligations to provide competent care, respect patient autonomy, and act as a patient advocate. It also adheres to regulatory frameworks that require PAs to practice within their scope of practice, collaborate with physicians, and ensure treatments are medically indicated and appropriately authorized. Advocating for the patient by exploring alternative pathways, such as appealing insurance decisions or seeking clinical trial enrollment, demonstrates a commitment to patient well-being within the bounds of ethical and legal practice. Incorrect approaches analysis. One incorrect approach is to immediately dismiss the patient's request without a comprehensive evaluation. This fails the principle of beneficence by potentially withholding a beneficial treatment and disrespects patient autonomy by not fully engaging with their expressed wishes and concerns. It could also violate professional standards if the PA does not adequately investigate the patient's condition or the potential benefits of the requested therapy. Another incorrect approach is to unilaterally agree to the patient's request without consulting the supervising physician or verifying insurance coverage and clinical appropriateness. This violates the PA's scope of practice, which typically requires physician oversight for advanced treatment decisions and prescriptions. It also risks providing care that is not medically sound or financially covered, leading to potential patient harm and financial repercussions for the patient and the healthcare institution. A third incorrect approach is to simply inform the patient that the treatment is not covered and cease further engagement. This demonstrates a lack of patient advocacy and fails to explore all available avenues to achieve the best possible outcome for the patient. It neglects the PA's ethical responsibility to help patients navigate complex healthcare systems and find solutions. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, gather all relevant patient information and understand the patient's goals and concerns. Second, consult relevant clinical guidelines, evidence-based literature, and the supervising physician to determine the medical appropriateness and feasibility of the requested treatment. Third, assess the patient's insurance coverage and any potential financial implications. Fourth, engage in shared decision-making with the patient, clearly explaining the risks, benefits, and alternatives. Finally, document all discussions, decisions, and actions taken, and if necessary, advocate for the patient through appropriate channels, such as insurance appeals or referrals to specialists. Question 14. Governance review demonstrates a need to enhance the OPAC team's approach to assessing pediatric patients presenting with concerns related to musculoskeletal growth and development. Which of the following strategies best reflects current best practices and regulatory expectations for OPACS in this domain? Option A. Focus solely on identifying and correcting any deviation from average adult anatomical proportions in pediatric patients to prevent future complications. Option B. Immediately initiate advanced imaging and specialist referrals for any child exhibiting a limb length discrepancy greater than 1 cm, regardless of age or other clinical indicators. Option C. Prioritize a comprehensive evaluation that integrates objective clinical findings, radiographic assessments interpreted against age-specific norms, and consideration of the child's overall developmental trajectory and family history. Option D. Rely primarily on parental reports of perceived growth abnormalities, without conducting independent objective clinical assessments or utilizing growth charts. The correct answer is C. Prioritize a comprehensive evaluation that integrates objective clinical findings, radiographic assessments interpreted against age-specific norms, and consideration of the child's overall developmental trajectory and family history. Explanation. Scenario analysis. This scenario presents a professional challenge for an orthopedic physician's assistant-certified OPA due to the inherent variability in pediatric musculoskeletal development and the potential for misinterpretation of growth patterns. The OPAC must balance the need for timely intervention with the risk of overtreatment or unnecessary anxiety for the patient and family. Accurate assessment of growth and development is crucial for distinguishing normal variations from pathological conditions, requiring a deep understanding of age-appropriate milestones and potential deviations. Correct approach analysis. The correct approach emphasizes a comprehensive assessment that integrates objective findings with the patient's developmental stage and family history. This aligns with the OPAC's scope of practice, which mandates thorough patient evaluation and the application of evidence-based principles. By considering the child's overall growth trajectory, including factors like height percentile, bone age, and functional milestones, the OPAC can make a more informed clinical judgment. This approach is ethically sound as it prioritizes patient well-being through accurate diagnosis and avoids premature or unwarranted interventions, thereby upholding the principle of non-maleficence. Regulatory frameworks for OPACS typically require adherence to established diagnostic protocols and a commitment to continuous professional development in areas like pediatric orthopedics. Incorrect approach is analysis. One incorrect approach involves solely relying on a single measurement or observation, such as a limb length discrepancy, without considering the broader context of the child's growth. This is a regulatory and ethical failure because it bypasses the requirement for a holistic patient assessment and can lead to misdiagnosis. For instance, minor, age-appropriate limb length discrepancies often resolve spontaneously as a child grows. Focusing on a single data point without considering developmental norms can result in unnecessary investigations or interventions, violating the principle of beneficence and potentially causing harm. Another incorrect approach is to dismiss parental concerns about growth or development without a thorough, objective evaluation. This is professionally unacceptable, as it disregards the patient's subjective experience and the valuable insights parents can provide regarding their child's history and behavior. Ethically, it fails to uphold the principle of patient-centered care and can erode trust between the OPAC and the family. Regulatory guidelines for OPACS stress the importance of effective communication and collaboration with patients and their families, which includes actively listening to and investigating their concerns. A third incorrect approach is to immediately recommend aggressive surgical correction for any observed deviation from perceived norms without exploring conservative management or monitoring strategies. This demonstrates a lack of understanding of the dynamic nature of pediatric musculoskeletal growth and development. It is a failure to adhere to best practices, which advocate for a stepwise approach to treatment, starting with the least invasive options. Ethically, it can lead to iatrogenic complications and unnecessary patient burden, contravening the principles of beneficence and non-maleficence. Professional reasoning. Professionals facing such situations should employ a systematic decision-making process. This begins with a thorough history and physical examination, paying close attention to developmental milestones and growth charts. Objective data, such as radiographic assessments, e.g., bone age, limb length measurements, should be interpreted within the context of the child's overall development and age-appropriate norms. Consultation with senior colleagues or specialists may be warranted for complex cases. The decision-making process should always prioritize patient safety, evidence-based practice, and open communication with the patient and their family, ensuring that all treatment options and their potential outcomes are clearly understood. Adherence to the OPAC's scope of practice and relevant state or national regulations is paramount throughout this process. Question 15. Quality control measures reveal a postoperative orthopedic patient experiencing moderate pain and swelling following a total knee arthroplasty. The patient has a history of peptic ulcer disease and mild renal insufficiency. Which of the following pharmacological management strategies best aligns with OPAC best practices and regulatory guidelines for this patient? Option A. Recommend acetaminophen as the primary analgesic, with no additional anti-inflammatory medication. Option B. Prescribe a selective COX-2 inhibitor NSAID at the lowest effective dose, with close monitoring for gastrointestinal and renal side effects. Option C. Initiate a course of oral corticosteroids to rapidly reduce inflammation and pain. Option D. Administer a topical NSAID to the affected knee to minimize systemic absorption and potential side effects. The correct answer is C. Initiate a course of oral corticosteroids to rapidly reduce inflammation and pain. Explanation. This scenario presents a common clinical challenge for an orthopedic physician's assistant-certified OPA, involving the selection of appropriate pharmacological agents for pain and inflammation management in a postoperative orthopedic patient. The challenge lies in balancing efficacy with patient safety, considering potential contraindications, drug interactions, and the specific needs of the patient, all within the scope of practice and regulatory guidelines governing OPACS in the United States. The correct approach emphasizes a thorough patient assessment and a nuanced understanding of NSAID and corticosteroid pharmacology, including their respective risks and benefits. This involves considering the patient's medical history, current medication, and the specific orthopedic condition being treated. The OPAC must select the agent that offers the most favorable risk-benefit profile, prioritizing patient safety and adherence to evidence-based practice guidelines. This aligns with the OPAC's responsibility to provide competent and ethical care, ensuring that treatment decisions are individualized and medically sound, thereby upholding professional standards and patient well-being. An incorrect approach would involve a superficial assessment or a reliance on a single class of medication without considering alternatives or contraindications. For instance, prescribing a potent NSAID without assessing for gastrointestinal risk factors or renal impairment would be a regulatory and ethical failure, as it deviates from the standard of care and potentially endangers the patient. Similarly, administering a corticosteroid injection without considering the risk of infection or the patient's underlying health conditions would also constitute a failure to adhere to best practices and potentially violate professional guidelines. The failure to conduct a comprehensive patient evaluation before initiating pharmacotherapy is a direct contravention of the principles of patient-centered care and responsible prescribing. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient history and physical examination, including a review of all current medications and relevant comorbidities. 2. Identification of the primary therapeutic goals, e.g., pain relief, reduction of inflammation, functional improvement. 3. Consideration of all available pharmacological options, including their mechanisms of action, efficacy, side effect profiles, contraindications, and potential drug interactions. 4. Risk-benefit analysis for each viable option in the context of the individual patient. 5. Selection of the most appropriate agent and dosage, with clear instructions for the patient and a plan for monitoring efficacy and adverse events. 6. Documentation of the decision-making process and rationale in the patient's medical record. Question 16. During the evaluation of a patient presenting with progressive weakness and numbness in the left upper extremity, the orthopedic physician's assistant certified OPA notes diminished sensation in the C6 dermatome and weakness in wrist extension. Which of the following neuroanatomical considerations is most critical for the OPAC to assess to differentiate between a cervical radiculopathy and a peripheral nerve entrapment? Option A. The integrity of the median nerve pathway from the brachial plexus to the hand, and its contribution to motor function and sensation in the C6 dermatome. Option B. The presence of a rotator cuff tear and its potential to cause referred pain and weakness in the upper extremity. Option C. The patency of the vertebral artery and its potential compression by cervical osteophytes, impacting blood flow to the spinal cord. Option D. The specific spinal cord segments involved and the sensory distribution of the C6 nerve root, as well as the motor innervation of the muscles responsible for wrist extension. The correct answer is A. The integrity of the median nerve pathway from the brachial plexus to the hand, and its contribution to motor function and sensation in the C6 dermatome. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the OPA to integrate detailed neuroanatomical knowledge with clinical presentation to accurately diagnose and manage a patient's condition. Misinterpreting the neuroanatomical basis of symptoms can lead to delayed or incorrect treatment, potentially causing irreversible neurological damage or functional deficits. The OPA must consider the intricate pathways of the peripheral and central nervous systems as they relate to musculoskeletal function and sensation. Correct approach analysis. The correct approach involves systematically correlating the patient's reported sensory deficits and motor impairments with specific nerve pathways and spinal cord segments. This demonstrates best professional practice by applying a foundational understanding of neuroanatomy to a clinical problem. It aligns with the OPAC's scope of practice, which includes assessing neurological function as it pertains to orthopedic conditions. This methodical approach ensures that the diagnostic process is thorough and evidence-based, leading to appropriate referral or management. Incorrect approaches analysis. One incorrect approach would be to focus solely on the superficial musculoskeletal complaint without adequately investigating the underlying neurological component. This fails to meet the standard of care by neglecting a potentially significant contributor to the patient's symptoms, violating the ethical obligation to provide comprehensive patient care. It could also lead to a failure to identify serious neurological conditions that require immediate intervention, potentially breaching professional responsibility. Another incorrect approach would be to make a presumptive diagnosis based on limited information or a superficial understanding of neuroanatomy. This bypasses the critical step of differential diagnosis and can lead to misdiagnosis and inappropriate treatment. Ethically, this demonstrates a lack of due diligence and a failure to uphold the principle of beneficence by not acting in the patient's best interest. A third incorrect approach would be to defer all neurological assessment to another specialist without performing an initial, targeted evaluation. While collaboration is essential, the OPA has a responsibility to conduct an initial assessment within their scope of practice to gather pertinent information and guide appropriate referrals. Failing to do so could be seen as an abdication of professional duty and may delay necessary care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough history and physical examination, specifically probing for neurological symptoms. This should be followed by a systematic correlation of these findings with known neuroanatomical structures and pathways. When uncertainty exists or complex neurological issues are suspected, consultation with appropriate specialists should be pursued, but only after a foundational assessment has been completed. This ensures that all aspects of the patient's condition are considered, leading to optimal patient outcomes. Question 17. The assessment process reveals a 65-year-old male patient presenting with a new onset of persistent, dull ache in his right proximal humerus, progressively worsening over 3 months. He denies any history of trauma. Radiographic imaging demonstrates a lytic lesion with ill-defined margins and periosteal reaction in the diaphysis of the humerus. The supervising orthopedic surgeon has requested your assistance in formulating the next steps for diagnosis and management. Option A. Recommend a core needle biopsy of the lesion under fluoroscopic guidance to obtain tissue for histopathological examination, followed by consultation with oncology if malignancy is suspected. Option B. Prescribe a course of non-steroidal anti-inflammatory drugs, NSAID, and recommend rest, with a follow-up X-ray in 6 weeks to assess for improvement. Option C. Advise the patient that the findings are likely degenerative and reassure him that no further investigation is immediately necessary. Option D. Refer the patient directly to physical therapy for aggressive strengthening exercises to address the pain, assuming it is related to muscle strain. Correct answer is A. Recommend a core needle biopsy of the lesion under fluoroscopic guidance to obtain tissue for histopathological examination, followed by consultation with oncology if malignancy is suspected. Explanation. This scenario presents a common challenge in orthopedic practice, differentiating between a primary neoplastic process and a reactive or degenerative condition that mimics malignancy. Professional challenge lies in accurately diagnosing the underlying pathology to ensure appropriate and timely management, avoiding both undertreatment of a serious condition and overtreatment of a benign one. This requires a thorough understanding of orthopedic pathology, careful interpretation of clinical and imaging findings, and judicious use of diagnostic tools, all within the scope of practice for an orthopedic physician's assistant certified OPA. The correct approach involves a systematic evaluation that prioritizes definitive diagnosis. This includes correlating imaging findings with the patient's clinical presentation, considering differential diagnoses, and proceeding with appropriate tissue sampling if imaging and clinical suspicion warrant it. This aligns with the OPAC's role in assisting with diagnosis and management under the supervision of an orthopedic surgeon, adhering to established clinical guidelines and best practices for patient care. The emphasis is on evidence-based decision-making and patient safety, ensuring that diagnostic pathways are followed logically and efficiently. An incorrect approach would be to solely rely on imaging without further investigation, especially if the findings are equivocal or concerning for malignancy. This could lead to delayed diagnosis and treatment of a malignant tumor, a significant ethical and professional failure. Another incorrect approach would be to initiate treatment for a presumed benign condition without a definitive diagnosis, risking the progression of an undiagnosed malignancy. Furthermore, performing invasive procedures without appropriate indications or consultation would exceed the OPAC's scope of practice and violate regulatory guidelines concerning patient safety and professional conduct. The professional decision-making process in such situations should involve a structured approach. 1. Gather comprehensive patient history and perform a thorough physical examination. 2. Review all available diagnostic data, including imaging studies, laboratory results, and prior medical records. 3. Formulate a differential diagnosis based on the gathered information. 4. Consult with the supervising orthopedic surgeon to discuss findings and potential diagnostic pathways. 5. If indicated, recommend and assist with appropriate diagnostic procedures, such as biopsy, ensuring informed consent and adherence to sterile techniques. 6. Collaborate with the surgical team to develop and implement a treatment plan based on the confirmed diagnosis. Question 18. Quality control measures reveal that a specific orthopedic surgical technique for a common procedure has been consistently modified by an OPAC in a manner not documented in the standard operative protocol, leading to a slightly shorter operative time. What is the most appropriate course of action for the OPAC? Option A. Document the modified technique as the standard procedure in all future operative notes without informing the supervising physician. Option B. Immediately report the observed modification to the supervising physician for review and discussion regarding its potential impact on patient outcomes and adherence to established protocols. Option C. Continue performing the modified technique as it appears to improve efficiency and update the operative notes to reflect the change without further consultation. Option D. Revert to the standard operative technique immediately and make no mention of the observed modification to anyone. The correct answer is B. Immediately report the observed modification to the supervising physician for review and discussion regarding its potential impact on patient outcomes and adherence to established protocols. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a deviation from established surgical protocols for a common procedure, potentially impacting patient safety and outcomes. The OPAC must exercise sound clinical judgment and adhere strictly to the OPAC scope of practice and relevant orthopedic surgical guidelines to ensure patient well-being and maintain professional integrity. The challenge lies in balancing the desire for potentially improved efficiency or patient comfort with the imperative of evidence-based practice and regulatory compliance. Correct approach analysis. The correct approach involves a thorough review of the observed deviation by the supervising physician and a subsequent assessment of its impact on patient outcomes and adherence to established protocols. This aligns with the OPAC's responsibility to practice under physician supervision and to ensure that all procedures are performed in accordance with accepted standards of care and institutional policies. Regulatory frameworks for OPACS emphasize patient safety, adherence to scope of practice, and the importance of physician oversight in all clinical decisions and procedural modifications. This approach prioritizes patient well-being and ensures that any deviation is justified, documented, and approved by the supervising physician, thereby upholding professional and ethical standards. Incorrect approaches analysis. One incorrect approach involves continuing the modified technique without physician consultation or review. This represents a significant ethical and regulatory failure. It bypasses the essential physician supervision required for OPACS, potentially leading to patient harm if the modification is not safe or effective. It also violates the principle of practicing within one's defined scope and established protocols, which are critical for patient safety and regulatory compliance. Another incorrect approach is to immediately revert to the standard technique without investigating the reasons for the deviation or assessing its potential benefits or risks. While reverting to a standard technique might seem safe, it fails to acknowledge the potential for innovation or improvement that might have been inadvertently discovered. It also misses an opportunity for professional development and for the OPAC and supervising physician to collaboratively evaluate and potentially refine practice, provided such refinements are evidence-based and approved. This approach can stifle learning and improvement within the practice. A third incorrect approach is to document the deviation as standard practice without any further review or physician notification. This is a serious ethical breach and a regulatory violation. It constitutes falsification of records and a deliberate attempt to conceal a deviation from established protocols, which undermines patient trust and the integrity of the healthcare system. It also prevents any potential learning or correction of unsafe practices. Professional reasoning. Professionals facing such a situation should first recognize the deviation from the standard procedure. The immediate next step is to cease the deviation if it poses an immediate risk to the patient. Then, the OPAC must promptly report the observation to the supervising physician. A collaborative discussion should ensue to understand the rationale behind the deviation, review relevant literature or evidence supporting any proposed modification, and assess the impact on patient safety and outcomes. Any decision to alter a standard procedure must be made in consultation with and approved by the supervising physician, with appropriate documentation of the rationale and any changes implemented. This systematic approach ensures patient safety, upholds professional accountability, and maintains compliance with regulatory requirements. Question 19. Regulatory review indicates that an orthopedic physician's assistant certified OPA is reviewing a series of anterior, posterior, and lateral radiographs of a patient's knee. The patient reports anterior knee pain, particularly with flexion. The OPAC observes what appears to be a small osteophyte on the posterior aspect of the patella. Which of the following approaches best reflects the OPAC's professional responsibility in interpreting these findings? Option A. Identify the osteophyte as the primary pathology and focus all subsequent diagnostic considerations solely on this finding. Option B. Accept the preliminary impression of a colleague that the osteophyte is an incidental finding and proceed without further independent assessment. Option C. Conclude that the osteophyte is the definitive cause of the patient's pain and recommend surgical excision. Option D. Systematically evaluate all visualized anatomical structures for abnormalities. Correlate any findings with the patient's reported symptoms and history, and consider differential diagnoses. The correct answer is C. Conclude that the osteophyte is the definitive cause of the patient's pain and recommend surgical excision. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic practice, interpreting radiographic findings in the context of a patient's clinical presentation. Professional challenge lies in accurately identifying subtle radiographic abnormalities that may or may not be directly responsible for the patient's symptoms. A misinterpretation can lead to delayed or incorrect treatment, impacting patient outcomes and potentially leading to professional repercussions. The OPAC must demonstrate a robust understanding of normal radiographic anatomy to effectively identify deviations and correlate them with clinical findings, adhering to established standards of care. Correct approach analysis. The correct approach involves a systematic evaluation of the radiographic images, focusing on identifying specific anatomical landmarks and assessing their alignment, integrity, and any signs of pathology. This includes a detailed examination of bone morphology, joint spaces, and surrounding soft tissues. The OPAC must then correlate these radiographic findings with the patient's reported symptoms, medical history, and physical examination results. This integrated approach ensures that the radiographic interpretation is clinically relevant and contributes to a comprehensive diagnostic and treatment plan. This aligns with the OPAC's responsibility to provide competent patient care, which necessitates accurate diagnostic interpretation and clinical correlation, as implicitly required by professional standards and guidelines governing physician-assistant practice in orthopedics. Incorrect approaches analysis. Focusing solely on the most obvious radiographic abnormality without considering the patient's symptoms is an incorrect approach. This can lead to overdiagnosis or misattribution of symptoms to incidental findings, potentially delaying treatment for the actual cause of the patient's discomfort. This failure to integrate clinical information with radiographic findings represents a lapse in professional judgment and deviates from best practices in diagnostic reasoning. Interpreting the radiograph without a thorough understanding of normal musculoskeletal anatomy is also an incorrect approach. This can result in misidentification of normal variants as pathology or failure to recognize subtle but significant abnormalities. Such a deficiency in foundational knowledge undermines the OPAC's ability to provide accurate diagnostic services, a core competency expected of certified professionals. Relying exclusively on the referring physician's preliminary interpretation without independent critical assessment is another incorrect approach. While collaboration is essential, the OPAC has a professional responsibility to conduct their own thorough review and form their own informed opinion based on the evidence. Over-reliance on another's interpretation can perpetuate errors and fails to uphold the OPAC's independent role in patient care. Professional reasoning. Professionals should approach radiographic interpretation by first establishing a systematic method for image review, ensuring all relevant anatomical structures are examined. This should be followed by a critical correlation of these findings with the patient's complete clinical picture. When discrepancies arise, further investigation, consultation with colleagues, or additional imaging may be warranted. The decision-making process should always prioritize patient safety and the provision of evidence-based care, adhering to the scope of practice and ethical obligations of an OPAC. Question 20. The evaluation methodology shows a patient presenting with chronic low back pain following a lumbar fusion. The orthopedic physician's assistant certified OPA is tasked with assessing the patient's functional capacity to determine their ability to return to their physically demanding job as a construction worker. Which of the following approaches best reflects a comprehensive and ethically sound assessment of functional capacity within the OPAC's regulatory framework? Option A. Conducting a thorough physical examination to assess range of motion, strength, and pain provocation, and then correlating these findings with the patient's self-reported ability to perform specific job tasks, considering their work environment and employer requirements. Option B. Relying primarily on the patient's subjective report of pain and perceived limitations, without extensive objective physical testing or consideration of job-specific demands. Option C. Administering a battery of standardized cognitive tests to assess the patient's ability to follow instructions, assuming that cognitive function is the primary determinant of functional capacity in this case. Option D. Focusing solely on objective physical measurements such as grip strength and gait speed, disregarding the patient's subjective pain experience and the specific physical requirements of their occupation. The correct answer is A. Conducting a thorough physical examination to assess range of motion, strength, and pain provocation, and then correlating these findings with the patient's self-reported ability to perform specific job tasks, considering their work environment and employer requirements. Explanation. This scenario presents a professional challenge because assessing functional capacity for an orthopedic physician's assistant certified OPA requires a nuanced understanding of a patient's ability to perform daily activities, work-related tasks, and recreational pursuits, all within the context of their orthopedic condition. The OPAC must balance objective clinical findings with the patient's subjective experience and the demands of their environment. This requires careful judgment to ensure the assessment is comprehensive, accurate, and ethically sound, adhering strictly to the regulatory framework governing OPAC practice. The correct approach represents best professional practice because it integrates multiple facets of functional capacity assessment, aligning with the OPAC scope of practice as defined by relevant U.S. regulations and professional guidelines. This approach emphasizes a holistic evaluation, considering not only the physical limitations imposed by the orthopedic condition, but also the patient's psychological state, social support, and environmental factors. It prioritizes patient-centered care by actively involving the patient in goal setting and utilizing standardized, validated tools where appropriate, ensuring the assessment is both clinically relevant and meaningful to the patient's life. This aligns with ethical principles of beneficence and non-maleficence, ensuring interventions are tailored to the individual's needs and capabilities. An incorrect approach that relies solely on objective physical measurements without considering the patient's subjective report or environmental context fails to capture the full picture of functional capacity. This can lead to an incomplete or inaccurate assessment, potentially resulting in inappropriate treatment plans or recommendations that do not adequately address the patient's real-world limitations. Ethically, this approach may violate the principle of patient autonomy by not fully valuing the patient's lived experience. Regulatory failure could occur if the assessment does not meet the standards of thoroughness expected for OPAC practice, potentially leading to a breach of professional duty. Another incorrect approach that focuses exclusively on a patient's perceived limitations without objective clinical correlation risks overestimating or underestimating functional capacity. This can lead to unnecessary restrictions or a failure to identify underlying physical impairments that require intervention. Such an approach may not align with the evidence-based practice expected of OPACS and could be seen as a failure to exercise due diligence in the assessment process, potentially leading to patient harm or a lack of appropriate care. A third incorrect approach that neglects to consider the patient's vocational or avocational demands overlooks a critical component of functional capacity. An individual's ability to perform specific job duties or engage in meaningful hobbies is a key aspect of their overall function and quality of life. Failing to assess these areas can result in recommendations that are not practical or sustainable for the patient, leading to frustration and potentially hindering their return to a fulfilling life. This represents a failure to provide comprehensive care and may not meet the standards of practice for an OPAC. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's orthopedic condition and its potential impact on function. Second, gathering objective clinical data through physical examination and diagnostic tests. Third, actively listening to and documenting the patient's subjective experience, including pain levels, perceived limitations, and personal goals. Fourth, considering the patient's environmental and social context, including their home, work, and community. Fifth, utilizing validated assessment tools where appropriate to quantify functional abilities. Finally, synthesizing all gathered information to form a comprehensive and individualized assessment of functional capacity, which then informs treatment planning and recommendations.